All right, great. Well, thank you. We'll go ahead and get started. So, just a little quick overview about how we got started in this work and why this is important to us. We have what we call our Path to Health Equity in Special Olympics International, and the P, A, and the T, and the H all stand for something different around our 4 pillars of health equity. And so specifically today, what we're going to be talking about is the T, or what we call our pillar 3. So it's all about how we are developing education and training for the next generation of healthcare workforce. So we really feel passionate and are very committed to making sure that the next generation of students and health professionals, as well as current health professionals, are comfortable and well prepared to provide inclusive health for people with IDD. So that's a little bit about our overview of who we are, which I'll talk about in a minute. But the other part of our work that you saw on that slide is that we're funded heavily by the Centers for Disease Control, as well as the Golisano Foundation. The Centers for Disease Control funds us domestic work, and then the Golisano Foundation funds us for international work. So that first slide really addressed some of the deliverables that we have with the CDC and why the training and specifically what we're hoping to do with our training. So you can see here are 4 pillars that I just mentioned. Pillar 1 is P for prevention, and we have a lot of early childhood intervention work that happens from this team. They're working with children from 0 to 2, and also working with a lot of families. So there's family health forums to educate families and caregivers on grappling with the new diagnosis, finding out how to best intervene and help their child develop appropriately. And then pillar 2, many of you may be familiar with our Healthy Athletes work. That's our assessment, and that's the work that we do globally to provide free screenings to our athletes when they come to health events. Those screenings are in now 9 disciplines, happy to say, and everything from our opening eyes, so vision screening, hearing screening, oral health, podiatry, physical health, health promotion. Strong Minds is our latest, most recent one around mental health. And then our MedFest, which really centers around physicals, sports physicals for our athletes. So the important thing about the assessment pillar also is the importance of us being able to connect our athletes to care afterwards. So when we screen our athletes, it's not just that we want to screen them to see how they're doing, but we want to, one, provide health education, but then to also make sure that they're connected to care back in their home community. So that's an important element of that pillar 2. Pillar 3, as I said, we're going to be sharing today a lot of our work around training and education of both health profession students as well as health professionals, and then also community health workers and others. And then our pillar 4 is around health system strengthening and transformation. So that's really a lot about our advocacy work, our public policy and advocacy work, working not just within the United States, but then also abroad with ministries of health, World Health Organization, et cetera. So here, let's talk a little bit about our target audiences and who we're hoping to address. You heard me mention students and health professionals, and those are our 2 big priority groups. But we also have other groups of individuals that we want to affect as well. And so we're doing some work in those areas. But today we're going to be talking mainly about health profession students and our health professionals. But I will say our clinical directors, who are our volunteers, and those are primarily volunteers in our Healthy Athletes capacity. We're in the process of updating all of their training, because we're updating our Healthy Athletes forms and our processes, and a lot of exciting work happening there. So they're going to be getting all new education training. We also do some non-professional education for coaches. So anything from, for example, preventing head injuries when our athletes are participating in sports, to just general knowledge and overview of making sure our athletes are training in a healthy manner, doing stretching, and making sure they're getting healthy snacks and water breaks, hydration, that sort of thing when they're training. Our community health worker education, we're excited that we're also doing some new training now, preparing some similar modules that you may have seen and that we'll be talking about here today. But we've also done one module for community health workers because even though CHWs aren't used a lot here in the United States, they certainly are used globally in Indonesia, China, Africa, etc. And so we want to make sure that CHWs as non-licensed, but as kind of care providers and linking people with IDD to resources, that they feel comfortable also working with folks with IDD. And then last but not least, we really hope to impact organizations. So organizations, everything from health systems, hospitals here in the States, to ministries of health, to maybe private employers who may be employing people with IDD, and they want their staff to become more familiar with their how to communicate better and more effectively with their colleagues, etc. So we've got a lot that we want to tackle, but today primarily we'll be talking about those two top circles. So a little bit quickly about our strategy. When I started at SOI about 2 years ago, we had a lot of training that kind of had been in place on our Special Olympics portal, but we didn't have a cohesive strategy. So in talking with colleagues and experts like you and many others, our programs across the states and across the globe, as well as some of our clinical directors, our discipline managers, etc. It was clear that we needed kind of a multi-faceted approach. So the first block really is a fundamentals block, building up till we get to hopefully a fellowship in the future. But our first block is really didactic, basically core concepts for beginning health profession students, or for a licensed professional like myself, if I wasn't familiar with how to care for people with IDD. If that was a new subject or a new patient population I was serving, I would likely find helpful information in this inclusive health fundamentals. All of this is considered to be interprofessional education in nature. So it's not for nurses, for physicians, pharmacists, etc. It's for everyone, any health profession. So public health student, a psych student, rehab students, RD, registered dietitians, etc. Anyone can benefit from this. So the modules that we'll be talking about today are really kind of plug and play, if you will. So they can be used in a curriculum wherever that university feels it's appropriate to put them. We're not telling universities at all where to place these and how to use them. We give suggestions and some best practices that we're kind of learning as we go what to do with the modules, but it's really the academic institutions choice as to where and how they use them. But we do suggest that the students complete all 5 because we feel like there are core concepts there that are important and relevant for anyone. And it really gives a broad, comprehensive background of information for students. The next block there you'll see is an introduction for students in terms of clinical introductions, IPE. And what we hope to accomplish with this, and we're getting ready to launch this fall, we're working with several organizations, academic organizations, to look at how can we use our athletes as standardized patients in a clinical simulation environment. Many folks have told us that the fundamentals is great, but we really need our students to be introduced to people with IDD so that they can learn firsthand from them what works or what doesn't work in terms of communication, in terms of their rights, ethics, lots of different things. So we think no better than to hear from some of our athletes and those athletes who are already trained as health messengers. And we have them in pretty much most of our programs, at least here in the States. And we hope to use those students or those athletes then to work with the students in, as I said, as standardized patients in a clinical sim environment. So we're piloting with several organizations: University of Maryland, University of Arkansas, University of Central Arkansas, and University of Washington. Did I get those correct, Rebekah? Okay, great.
Yes, and one in Arizona.
Yeah, and we'll be talking more about those coming up. The next type of education that we hope to bring really starting later this year, moving on in the future, is more specialty based, more intensive deep dives into topics. So for example, if you were going to work in pediatrics or women's health, for example, what would be the kinds of things that are really, really important and critical to know when you're serving women with intellectual disabilities in terms of their reproductive health, intimate partner relationships, that sort of thing. Also, as well as how to deliver a diagnosis. For example, if you're a pediatrician or a pediatric nurse and you're working with the family, getting a diagnosis, what is the best way to do that? So really taking a deeper dive into whether it be women's health, pediatrics, or mental health to provide that depth. And then finally, what we hope to do in several years is to have a fellowship where we have professionals who would apply and work with us over, say, perhaps a period of a year. And we could really introduce them to not just our United States programs, but globally what is happening. And, either if they are interested in research, practice, education, et cetera, they would get a much more, I think, robust experience from a fellowship. So that's kind of where we are now. There on the left-hand side of the screen, and then how we hope to move over the next couple of years. So.
Sorry, and my slides seem to be frozen.
It's okay.
There we go.
There we go. Okay. So what you all have probably heard a little bit about is that our accomplishments to date was we completed our phase 1 pilot in this past spring. And we worked with 4 U.S. universities and 1 international university. And you can see the folks that participated there. And we were really appreciative of all the efforts from all the different universities. And we're going to now share with you some of the things that we found and what we learned from the students and from the pilot. Okay, thanks, Rebekah. So real quickly, the modules here are listed in order that we suggest students or professionals use them in. And you can see there, it starts with an introduction as to what is IDD. What are we talking about? Really opening the floor to having folks understand autism spectrum disorder, as well as the various intellectual disabilities, Down syndrome, Fragile X, and all the myriad of other syndromes. We then move into module 2, which are really models of disability. We changed that title a little bit to say models of disability. So we're talking about the medical model, social model, et cetera. We get into intersectionality there also, and talking about intersectionality of race and having IDD, et cetera. The next module is around health promotion and talking about the importance of getting everyone with IDD to engage in their own health and why that sometimes is a challenge. And then we have an entire module on communication, which we think is important, very, very important. We've heard from students that's really highly important to them. And then rounded out with module 5, which are the common health problems, both physical and mental health problems that folks with IDD face. So in terms of the evaluation, we did several different pictures or snapshots, if you will, of evaluation. We did a quantitative analysis and a qualitative analysis of the students, the participants, as well as a qualitative analysis of faculty, like focus group and informant interviews about what worked, what didn't work. And you'll see we're going to go through some of the highlights of these on the next couple slides. So first of all, we were happy to say that we had well over 500 health profession students who participated and had a high degree of completing the pre-evaluation as well as the post-curriculum evaluation. It's probably not surprising that the majority of the students who took the class were nursing students, and then obviously they were female because it's a highly, as many of you know, female is about 90% of the nursing profession across the states. And it was obviously a young group as well, young adults who completed it. About half, a little over half, said that they had completed some type of previous training already in intellectual developmental disability. So either within their own curriculum or another course that they took as an elective. You can see here the different health profession majors that were represented. And then we had some other majors, and these we think are maybe students who were taking an intro class to health care, intro to health professions, and took it to see if they maybe wanted to go into this work. Not really sure, but you can see we had lots of different majors in the other category, but the predominant majors were really in nursing, rehab professionals. You can see public health medicine, psych, developmental psych, and then applied healthcare professions. So some of the highlights, we ask pre and post to rate your knowledge of IDD. And 8% of the students reported that they were very knowledgeable at the beginning before this started, and 13%, 14% said not at all knowledgeable. And so that's okay. Rebekah, go ahead. And so what we did then is we compared the post, asked the same question, and you can see that there was some difference. There was some movement here in terms of the margin of error. So certainly you can see that there was a difference in the very in post and also in the moderately, and then it's somewhat, so everything kind of shifted to the right, if you will, shifted to the students feeling like they were more moderately familiar with and had more knowledge of caring for people with IDD. The next question, pre and post, we ask them around their kind of talk about their confidence level. They're confident in their ability to communicate effectively with people with IDD. We heard, and you'll hear Rebekah talk in much more depth about this later, that communication was probably the #1 thing that students wanted to know about, as well as behavior, how to understand behavior, either nonverbal behavior predominantly of some people with IDD, and how they express their needs that way. So you can see there was some movement also, especially in the strongly agree category with that margin of error. So we were pleasantly pleased with that movement as well from pre to post. And then we did ask a question around in career intention, that after pre and post, their interest in working with people with IDD as part of their career. So not as much movement in the somewhat categories, but certainly in the strongly agree. And so we don't know completely. If certainly we'd have to do a lot more research to understand what that means, if they really continue that intention as they move through their curriculum. But again, these were positive results that we were happy to see. And then another question just around feeling about how this information would help them in their career. And again, not as much movement and change in terms from pre to post, but again, they're feeling that they do agree, strongly agree, the most majority of them, that this information is going to help them in their career. Another question that I've used a lot in is used a lot in the literature is likelihood to recommend, which really addresses individuals' intent to remember the information and recommend it to a peer. And you can see there that we had 94% of the respondents said that they would recommend this training to a peer. And then 82% of them also reported that they were interested in additional training in the field of IDD. So now I'm going to hand it over to Rebekah, and she's going to walk you through the qualitative comments in depth. I'll just say that if I have to sign off before I get to say goodbye, or before we get to questions, I'm sure I'm leaving you in great hands with Rebekah, because I have to do a walk in and do another in-person presentation here in a few minutes, but I'll stay on as long as I can. So Rebekah, over to you.
Yeah, thanks, Anne. So one of the things that we'll go over now is the qualitative analysis, like Anne said, and really a few themes came out in asking students what concerns they had or what did they feel less confident in. So anything that is in italics is a direct quote from a student. I won't read all of those. I know it's a lot of words, but you can see the quotes from the students and the comments that they in particular made. You can see here with regards to communication, before training, about 30%, a little over 30% of students had concerns around communicating with patients, patients understanding them, the students not wanting to say something wrong, and communicating with nonverbals patients. And then you can see that after the training, not quite half of that was reduced, but that communication was still a concern, but the concerns were more general. And certainly the students were asking for more practice in speaking with people who have intellectual disability. And so that's one of the reasons that we'll be moving into piloting the standardized patient project and also focusing on an experiential component. Another theme that came up was confidence. And so, but you can see before going through the modules, about 49 students said that they had concerns about their lack of experience, lack of knowledge, and fears about being able to meet the needs of people with intellectual disabilities, and then concerns about accidentally offending people. And this was reduced by about half in the post-training, that the most common concerns were about being able to effectively communicate and then accidentally offending people and saying the wrong thing. I think that's a great concern that, you know, students might have, but wanting to share with them that, you know, the fact that they're concerned about it is probably showing that their intention is to do the right thing and to be cautious and to be careful in the way that they're working with people with ID. Another one that came up was behaviors and safety. And so a small number of students before the training were concerned about behaviors and safety. So how to evaluate safety measures before working with adults with IDD. And then afterwards, still 9 students had concerns. And a lot of these comments were around working with challenging behaviors or not knowing what to do in a visit if someone with ID had a behavioral challenge in that visit. So ensuring that they knew what to do in those instances. Another theme that came out was focusing on the autonomy and dignity of people with ID. So before the training, 13 students had concerns about this, and you can see their comments there. The second one there, the primary concern is how to best support autonomy while also knowing what is the most appropriate time to intervene. And then post-training, still about, you know, not very many changed their minds. So we went from 13 to 9, and those students still had concerns about ensuring autonomy and dignity of people with ID. And then what was really interesting, I think, but also explainable, is that many students were concerned about having enough resources and services for people with IDD after completing the training. And I think that's likely because their awareness was raised. Before the training, there were 7 students who were concerned about this, and after the training, 11. Now, when we consider those numbers over the total number of students that took the modules, it's not a huge percentage, but still a concern. And some of the resources that the students mentioned included funding, and then also ensuring that there would be enough trained professionals and healthcare workers to care for this population. The last question that was asked of these students is how would they use this information? And the themes that were identified were around work and career, communication skills, clinical rotations with people and patients to inform others and bring them into this work, and then around autonomy, equality, dignity, and respect. And so the comments here were: the information in this training helped me to understand what the needs of people with IDD have that aren't being met, that they could use this information when they were a manager or in another higher up position. Another student said when they were communicating with patients with IDD, they will use this training to better connect and communicate with the patient and their family. Whenever working with a patient who has an intellectual disability, I can refer back to these modules to freshen up my skills. And then when with patients, I can make sure to treat patients with IDD the same as I would treat any other patient and not discriminate them for their disability, since they are a human too, even if they have some differences and struggles. I'm going to move now into the University of Minnesota evaluation and results. And the University of Minnesota used these modules in a disability and development course at the College of Education and Human Development Child Psychology program. And so because the students had already had the topic of disability and IDD introduced to them before they completed the modules, the faculty at Minnesota who ran the pilot there, they did not do a pre-post evaluation because they felt like that was not the most appropriate given that students would have already been introduced to this topic. So we've already presented some of their selected demographics with all of the pilot data, but now we'll be going into the specifics of the evaluation at University of Minnesota. So there were a couple of different ways that the evaluation was completed. First, students were asked to complete multiple choice questions that were developed by the faculty at the end of each module. And then they also had a focus group of 7 undergrad students. There was also a group of postdoc fellows that were part of a technical expert panel, and then graduate and professional students as well as postdoc fellows completed the modules and provided feedback as well. So students could earn extra credit for completing each module. Students needed to answer 80% or more of the questions correctly in each module to be able to receive the extra credit. 58% of students completed more than one module and 85% completed all 5 modules. I'll note that the 85% who completed all 5 included the grad students as well. As you can see here, I listed the percent correct from the knowledge-based questions that students completed at the end of each module. And the students scored the highest on the module 2, which is the models of disability. And then you can see the other numbers there as well. Some statistics were run to look and see if there was any significance or any difference in the way that students had scored on the modules. And based on the ANOVA and the paired t-test, students scored significantly higher on module 2 than the other modules. Some themes that came out in the evaluation at Minnesota were that the modules allowed a deeper understanding of concepts around this topic, that they really liked the focus on a strength-based approach and contextualizing of IDD. They appreciated the discussion of intersectionality. And so here we have a comment from a student: while we discussed models that could be used to understand disability in class, we only covered a few of the models discussed in the learning module and really didn't go into any depth about ableism and intersectionality. Those were pieces of the puzzle I really hadn't thought out much. I mean, being a person who is Somali and has IDD is not necessarily the same as that of being white and having IDD. Some other results were that the students really enjoyed the videos of people with ID speaking about their experiences. Some of the modules include videos of self-advocates from your program, as well as some of our athletes. And then there was an interesting comment that I wanted to draw out, which is why it's in this presentation, that one pre-med student stated that they had taken no classes covering IDD in their coursework, and their sibling, who was a medical resident, indicated that they only had 20 minutes of lecture about screening for an intellectual disability diagnosis while in medical school. Some of the information that students wanted more more information about was intersectionality of race, gender, the underserved, urban versus rural communities, and IDD. And so there's a comment here from a student that they didn't want to be overly critical, but the content of a lot of the modules sounded like it was based on experience and research on upper middle white class people. And so I think that while we have some communication and information about intersectionality in the modules, it sounds like the students would like more. And we have a couple more comments about that as we move through the rest of the evaluation results. Students appreciated the questions at the end of each module to focus on the most important information, but they also suggested application type open-ended questions where they could answer how they would use this information, how would they apply it, rather than just knowledge-based questions. Students recommended an experiential component so that they could work together along with people with IDD as opposed to working for them. Students cautioned that these modules should be an introduction to these concepts. And so something that I thought was really interesting is students were very concerned that we would consider that these 5 modules would be all the training that someone would need. So the comment here, I think it would be scary if anyone were to think that these modules would be enough for a doctor, nurse, speech therapist, or anyone else to do a good job providing clinical services to someone with an intellectual disability. It might even give people a false sense of security. Other comments were around including more interactivity, the ability to monitor progress through the modules, and then the need to adjust for different presentation styles of the module presenters. What I should say is that the phase 1 pilot with the first round, the modules were essentially, a presentation. It was a PowerPoint that was recorded with a speaker, and then there were videos interspersed. And so because there were different speakers in each module, the students, I think, felt like they sometimes some speakers were, speaking more quickly, some more slowly, some read everything on the slide, some didn't. And so that adjustment that the students had to make was a concern of theirs. So then the technical expert panel, they had some feedback as well. And so I've put everything on this one slide. I know it's a lot of text, but the pros were that they really liked they were very complimentary of the strength-based social ecological model used to develop the modules. They commented positively on the connections made between diversity, identity, and disability. Other strengths included the communication module content and the discussion of diagnostic overshadowing. They really liked that. Some of the cons that they brought up were that they cautioned that the language and assumptions should be appropriate to new users and learners. They felt like it should be very clear that this was introductory material. Some content was repeated throughout the different modules. So if it was presented in module 1, sometimes it was also presented in other modules. They also said that they would like to encourage that we have learner engagement to break up the content delivery, and a need for accessibility resources such as narration or other audio description, consistency in content delivery, and a progress monitor, which was brought up previously as well. Their final recommendations were that they felt these modules were a great addition to any course in the human services field. They had concerns that, again, a program might think that this is all that it needs to be done to train to someone to work with people with IDD. And they recommended including more information about intersectionality of disability and diversity. So I hope you can see the themes that were coming across there. I certainly can. So our next steps are that we have already worked with an e-learning vendor to upgrade the modules to a more interactive format for the fall semester, which is ongoing. One of the changes that we made was we include knowledge-based questions throughout the module to break up the content. And we also have reflection prompts throughout where students would be prompted to type in their thoughts, think about how they would handle something, et cetera. So trying to get at that application piece. We have expanded our pilot for phase 2, which is what we're calling this academic year, to 20 health profession schools. And more seem to be coming on every day that are interested. So we're really excited about that. We will be developing new modules based on additional areas of need identified by the student. So I think we all heard some of the comments, some of them about wanting more information about intersectionality, some wanted more information on communication, some wanted more information on behavioral skills and strategies. So we're looking into areas of developing new modules there. And then also, as Anne said, we're starting the development on our specialty-based modules this year. And so one of them that we already have identified and have started working on is mental health challenges. So we'll be having a more in-depth module there as well. These first 5 modules, the inclusive health fundamentals, we have started translating into Spanish, and those will be ready in the next month or 2. And then we have a couple of schools in the Latin America region, Paraguay, Chile, and Nicaragua, who would like to use these modules starting in January 2024. We also are piloting an experiential component. As you could see and hear from the student feedback, they really wanted an opportunity to work with people with IDD. So we have 4 U.S. Special Olympics programs and 5 universities who are piloting training health messengers as standardized patients for clinical simulation laboratories, as well as interprofessional education days. So depending on how universities have those structured in their curriculum, we're kind of going with the flow and then working on the back end as far as training our health messengers to be able to go into the classroom and work with the students. We also will have these 5 modules on HealthStream. If you are familiar with that service, it is an online delivery of typically types of trainings like HIPAA compliance and, you know, accidental needle sticks and things like that. They have 75% of the market share in the United States, and we'll be hosting our modules. They just went live, I think, this week. We're excited for healthcare professionals who are working in a health system to maybe have access to those modules if they're on their system taking other courses. And then we're also working on accreditation to offer continuing education credit and professional development credit with an organization called Joint Accreditation, and they accredit interprofessional education for CE. So we're really excited about that. We're starting the process with them, and the self-study takes about a year. So we're hopeful to be approved by next summer. And then I just want to point out the 2 photos over here on the side are the screenshots. These are essentially what our new modules look like. And I love the colors, I love the photos, but I also wanted to point out that, for example, on this bottom screen here, you can see like there's these little tabs across the top, and the students would click on those to get the information. And then we use one narrator for all the new modules so that there's consistency in the delivery. We have the ability for closed caption as well as other transcription, and a whole bunch of resources available for students to be able to track their progress through the modules. They can stop and come back and restart where they were, which wasn't available in the first round. So we're really excited about some of the changes that we've made in this round of the modules. So Anne and my information is here, and I think we're right at about time. And so I'll stop sharing and take any questions you have.